Welcome to Health Diary. My name is Gladys Gashanda, and today we're coming to you from the 4 Points by Sheraton here in Hallingham. Now, all of us know somebody either in the present or in the past who stammers or stutters. Now, unfortunately, those who live with this condition face a life of ridicule and limited opportunities. Many give up on school at a very tender age because of the stigma they face, and others, they are denied employment opportunities just because of how they speak. Question is, do we know what causes stammering? Well, we'll find out about that and much more right after this fact of the matter. Stammering or stuttering is a speech disorder that impedes normal fluency and flow of speech. People who stutter know what they want to say but have difficulty saying it. Though young children may stutter when their speech and language abilities are not developed enough, most outgrow this developmental stuttering. However, for some children, stammering is a chronic condition that persists into adulthood. Early intervention and treatment may not eliminate all stuttering, but can help improve speech fluency.
Nikimzaa alikuwa sawa kama kawaida, but niligundua akifikisha miaka mitatu akianza kuongea. Hapo ndo nilijua hayuko sawa, nikagundua ako na hiyo challenge. Sasa kama mzazi nilifeel vibaya, mbona mimi nikazaa mtoto hivi. Kasema nimtafutie mahali at least niende nijaribu kama wanaweza msaidia. Kuna mtu nilikuwa nimemuuliza akaniambia nikienda Gertrude Hospital naweza fanikiwa. Sasa nikachukua hiyo jukumu kwenda kule kuuliza kuna hiyo nini inaitwa speech therapy. Kuuliza wakaniambia anaweza fanyiwa but per hour ni 4,500. Kama mimi single mother siwezi. Yeye akiamka asubuhi, anapenda kusikiliza muziki. Kitu atafanya atafungua redio. Anza kusikiliza muziki, osha vyombo. Alafu pia si achezi sana. Ama akikaa kwa tuna watu but si ile group wa nini nao sana sana. Akianza kuongea, saa zingine anaongea neno inakata kabisa. But unajua kama mzazi anataka kusema nini, inabidi umsaidie. Sasa nimepitia hiyo challenge but nashukuru Mungu. Sasa hivi anaongea, anafanya class 8. Sasa hiyo umwani ndio sasa ndio jaribu. But nashukuru Mungu maana nilipata Dominic. Sasa nilikuwa nasema tu at least kama kuna mzazi anayepitia shida kama hii, ajiunge na Dominic. Tusaidiane hii Be Patient Stammering Foundation. At least tusaidie wale wadogo wenye wanakuwa. Najua sasa kama huyu sahi ashajua shida yake. Sasa ule mdogo mwenye anazaliwa kesho yake itakuwaje? Sasa tuangalie pia hao tuwakuze.
So what exactly is stammering or stuttering? And these are terms that we shall use interchangeably in this conversation. To help us along with this is Duncan Ndirango, who is speaking or speaks with a stammer. And of course, Dr. John Omaonala, who is a developmental and learning disability consultant. Thank you, gentlemen, for joining me this Sunday. And I'll start off with you, Daktari. A speech disorder that affects normal fluency and flow of speech is how we've defined stammering or stuttering. So what causes this?
In children, in most cases, it's developmental. So you find children in early years, before the age of 5, stammering a lot as they learn fluency, because stammering is a problem with fluency. But most people who continue stammering up to adulthood, majority of them would be stammering because of neurological issues. So the way they process language, sometimes they get blockage in the process of processing language. And that affects the way they pronounce or the way they articulate their words. But we can also have other causes like maybe accident or stroke, or quite a number of other things. But we also have people who temporarily stammer, maybe because of anxiety, Yeah, because of depression, because of quite a number of things. So, but that will not be classified as being a stammerer. But when you say someone is a stammerer, it means that that person experiences problem with processing language.
How do you tell the difference between this child is learning to speak and there's a problem here?
We look at the frequency of stammering. If, let's say, a 3-year-old child is stammering, maybe he wants to have your tablet and says, Mama, can I have your tablet? That's different. So, but if it's so frequent that it's affecting the child's learning, and social interaction, and social communication, then you should be concerned. However, we say that in early years, if you expose children to a language-rich environment, then they are going to outgrow the challenge. But if it's so frequent that it affects children's ability to learn and to interact with other children, then you need to seek a second opinion, maybe from a speech therapist or from a neurologist.
Mm-hmm. Okay, so Duncan, when did you discover that you speak differently from the other kids?
I think I discovered when I realized myself at an age of around 6 years. That's when I knew that I'm not speaking like my brothers, for example. Yeah.
What did the parents think it was?
The parents didn't do any much thing because themselves also didn't know what to do. So I basically grew speaking like that and trying to cope with the situation. There was no much assistance that came from my parents or from any other person who realized that maybe I stammer. So I just grew talking like that.
Uh-huh. Yes. So when you talk about stammering, how does yours sound like? Because there are different ways of stammering.
Well, mine, I think it usually delay in maybe mentioning some words, and also maybe as maybe I'm a bit maybe nervous. It becomes very hard for me even to mention some names or even to make a speech. In the middle of trying to talk, I just stop and maybe take a breath and then again try to talk again.
So as I mentioned, Daktari, people stammer differently. So which are these categories?
Yeah, we have those ones who will find it difficult to articulate initial consonants. So for example, cat or man, so initial consonants are affected. And we also have those ones who will find it difficult to articulate the whole word. So like school. And then we have those ones who will have total blockage. And so they'll take long before a word can come out. So it's all to do with fluency. And we have those ones whose the whole sentence or phrases are affected. So they will all be affected at different levels.
The different categories, are they determined by severity?
The assessment that we do will then categorize them based on severity. So we have mild, moderate, and severe. But for the purpose of evaluation, we calculate standard scores. So we say someone scoring, let's say, between 85 and maybe 70 is experiencing mild challenges in fluency. And how do we assess that? We time them. There are different tests that we'll do. One of them is speed naming test, where a person will be given a number of pictures to name as we time them. And then we change that into standard score. Like my friend, I would say smile.
Yeah. You've already done an assessment.
Yes, I've been listening to him there and say, oh, that's a mild case.
Okay.
Yeah.
And with this mild case, what are the challenges you found yourself facing, especially when it came to school?
Sometimes I could be punished because I failed to express myself. Maybe it's a mistake that was done by somebody else. But maybe we were in a group. Unfortunately, when I'm told now maybe to explain what happened, I was unable to explain. So therefore, I could be punished severely. Not because I did a mistake, but because I couldn't express myself of what happened.
So you looked guilty?
Yes. In most of the times, even at home, and even my neighbors around home, they couldn't sometimes understand me. So they could maybe punish me for no reason, or else they could laugh at me. I don't know how to speak, and I'm big enough. So I could feel, no, I think there's something wrong with me. Yes.
Okay, and I just noticed that even for those who speak with a stammer, there's some physical attributes that come with the same.
So you're struggling to bring out the word. So in that process, the brain is fully engaged, and therefore it leads to some motor challenges. So challenges would include things like flicking the eyes, or opening the mouth, or generally fidgeting. We have those ones who will fidget with their hands. There are those ones who will tremble, or maybe the lips trembling. So there are quite a number of motor challenges that always accompany stammering.
Is it possible to stammer and not have the physical attributes?
It's possible to stammer and not have physical attributes, especially in the mild cases. But in moderate and severe cases, there will always be those physical attributes. But then they learn to cope with it. So like speaking slowly, moderating, breathing, and quite a number of other skills that they learn with time. And then you find that those symptoms go down. And so you have some people who stammer, but when they're asked to give a talk or a presentation, then they will be fluent. Yeah, but then when they're under pressure, then they stammer more. Yeah, so it depends on the coping strategies that they have been taught or that they have learned over time. Yeah.
Okay, now, does stammering reduce with age? Has yours reduced with age?
Yes. I think when I was growing, maybe when I was young in primary school and partly of high school, I couldn't literally utter some words. But I think as I'm growing and again gaining more confidence in myself, the issue of stammering has greatly gone down, as in has greatly trying to reduce compared to when I was young.
You mentioned earlier that you never got intervention. So how did you learn to cope with the stammer?
Well, it hasn't been easy because I've been fighting all through myself. I've learned to just be myself. When you stammer, sometimes in many cases you will lose confidence. Even with people, you will feel, no, I don't fit in this group. But personally, I think I decided to just be myself. When I just go to a place, I stammer, well and good, it's me. So I think I've tried to just walk through life being myself without being influenced by my friends, or when they laugh at me, I just decide to just move on.
Now, Dr. clearly, are we saying that there are cases that they just learn how to cope, no interventions, and they turn out fine?
Majority of them, especially in developing countries where help is quite minimal. So most people, like in Kenya, most people who stammer don't get any kind of help. So they learn from their parents who keep correcting them. Yeah, maybe dad makes fun of that and mom corrects the child, and then they keep learning as they go. Speech therapy is still new in Kenya, so we have very few speech therapists. And so very few children can access any kind of help. But again, as they grow up, I've met people who are stammering more. I actually know of a speech therapist who used to stammer. Yeah. Yeah, he was my classmate. He stammered more, he graduated as a stammerer, and then when he enrolled for a master's degree in speech therapy, his stammering started going down. He learned coping mechanism as an adult.
Okay, now you've heard Dr. talk about coping mechanisms and interventions. So what is available out there? We'll talk more about that right after this break. Welcome to Health Diary. My name is Gladys Gashanja. The conversation today, stammering or stuttering, and this is a word we are interchangeably using in this conversation. Still with me, Dr. Onala, and of course Duncan, who lives with a stammer. Now, they say stammering is more common in boys than girls. Why?
Yes, when we study disability, we have the biomedical understanding, and we also have psychological understanding. If you look at it from the psychological perspective, girls start talking a little bit earlier. When they go to the kitchen with mom, they are constantly talking and mom is correcting them, and so they develop fluency earlier than boys. Boys spend a lot of time doing a lot of mechanical things. driving a car, playing football, and they rarely talk even when they are left with their dad. So by the time children are joining school at the age of 3 or 4, girls are more fluent and they start learning phonics quite well, while boys are still struggling with language and stammering more. But then again, looking at it from the biomedical side, developmentally, again, boys take long to develop fluency for the wiring of the brain and quite a number of other things. So, and then when there's things to be inherited, so like autism or dyslexia, you still find that boys are more affected again because of their genetic makeup. Yeah, the Y chromosome is a barren chromosome.
All right, interesting perspective. So, Duncan, you alluded to the stigma you've had to face, you know, living with a stammer, and the impact of the same, I mean, cannot be denied. What have you faced?
Recently, the issue when now after schooling, now I'm coming to the employment world. So for me to sit for that interview and maybe express myself has been a challenge. Actually, I've lost quite a number of opportunities just because I couldn't express myself maybe during that interview. I sometimes even fear to undertake some activities for me not to be, to fail or to be seen as if I'm a lesser person. So like in high school, I couldn't maybe do some games, or I couldn't maybe interact with other people, like in the debates. Actually, I grew to be wanting to be a lawyer, but when I realized that I can't maybe speak like how they do, I dropped that. So you see, I've lost maybe some opportunities which I could have taken well if I was maybe if I didn't stammer.
Now, you mentioned you just got married a few months ago. How has the dating life been?
Well, it wasn't that easy for me to actually express myself to that girl, let me call her so. Yeah, but one thing I could really thank God is that she accepted me the way I was. And actually, we started dating since campus. So actually, when I was in campus, I was more severe. Actually, well, the reason why maybe she could accept me is because I could even perform well in class, maybe when it comes to writing and all that. So I realized I have more strength, and she could encourage me on that. And therefore, we just moved on.
Dr. Onala, what is the possible complications of ridicule or stigma on those who live with a stammer?
Starting from early years, children who stammer are less likely to engage in more social activities than the neurotypical ones. Just starting from kindergarten, when they realize that they're not able to speak like their peers, they're not able to answer questions like the rest, they start coiling back. So the teacher asks a question, you know the answer quite well, but you can't put up your hand because you're not sure whether you'll be able to say the answer correctly or within the required time. So their level of confidence starts going down from early years. And then sometimes there's also peer bullying in school. So you can't talk well, and then they imitate the way you are talking. So that damages their self-esteem as they're growing up. But again, when it comes to academic performance, people who stammer would be slow in reading. So your comprehension is still intact, but your speed is lower than the neurotypical one. So, and that is usually not considered in examination in Kenya, in our Kenyan system. And sometimes the community will sideline them because they're not able to give the output that the community expects. So technically we say that disability is not a problem is the society.
Duncan, he talks about the mental health impact.
I've had those kind of episodes, and maybe the way I've packed myself in life, as in how to move on regardless of those barriers, has really helped me in terms of coping with the society. The moment that we realize that we are good to go, we can undertake that job, we can conquer the society as any other person. I think that is basically what has helped me maybe in my case to just move on with life and try to prove to the society that we are not lesser people just because we are stammering.
Do you have bad days?
Yes, I do have bad days. Something will happen in the office and my boss will have to be explained what happened. So I'll find myself there trying to explain, but words have gone. In most cases, I'll find myself just accepting some blames just to avoid so many conversations, which may lead to me being to me maybe being seen as an inferior. So I just accept some blames and then move on. But that one again will really hurt me inside. So I will have a bad day because definitely I will accept something I didn't do just because I couldn't express myself.
I guess the bigger question here for, parents, guardians is where can somebody get intervention? How early in childhood can you intervene for your child?
At the age of 3 or 4, children are joining school with very minimal language. They're stammering. More expressive languages, very low because parents are not engaging children at home. So what I would advise parents from early years, engage your child in a lot of conversation. So talk to your children, be there physically and socially with them. Talk to them, take them out. If you realize that the level of stammering or disfluency in language is significant, then it's good to seek for help from early years, from as early as 2 or 3 years. And then if you're in maybe Nairobi, Mombasa, Kisumu, you'll probably be able to access speech therapists. So yeah, in that case, you'll be given some basic skills on how to work with your child at home. In severe cases, children might need speech therapy, continuous speech therapy for some period of time for them to be able to learn basic fluency.
And where can you get these services?
If you're anywhere in this country, you can go to the nearest education office and ask for EAC. And then EACs do assessment. They'll do some basic assessment and advise you on a few things that you can do with your child. And then if that's not possible, if you're maybe in Nairobi, you can go to a place, most of the hospitals around, maybe like Kenyatta Hospital, there's the Child Development Center, we have quite a number of hospitals, you'll be able to get some help.
Now, Duncan, there has been calls about including stammering as a disability so that there can be prioritization of resources for those that live with this condition and also equal opportunity for the same group of people. Do you agree?
To some extent, I could really advocate for that we may be considered that we are not disabled, but we have a special kind of ability.
Yeah, I like what he's saying about those with a stammer have special needs. Dr. Ari, what should parents, teachers, caregivers, and even peers understand about how they can support those who live with a stammer?
First of all, if I just go back again to the same question that you asked Duncan, yes, whether it should be included under disability, when we do assessment, we have diagnostic statistical manual for classification of disabilities. And stammering is already classified as a disability, probably not registered as a disability in Kenya, but internationally it is a disability. Now, when we go now to what should the teachers and parents and caregivers do, one thing I would advise is that, if possible, dealing with language disorders should be put in the teacher training curriculum, starting from early childhood. Actually, it's covered a little bit in early childhood training, but primary school teachers and high school teachers should be able to handle these cases in school. So that's one. 2, the National Examination Council also need to understand that if a person stammers, then that interferes with the reading fluency and speed, and therefore they might need extra time in examination. And when it comes to home environment, parents need to understand that people who stammer go through a lot of challenges to be able to say words or look for alternative words, and therefore starting intervention early, the moment you realize that your child is not talking quite well or baby speaking continues for a long period of time, then start engaging them in bedtime stories. That helps a lot to improve the level of vocabulary and fluency. Also looking at the employers, we are all different. So we have those ones who are skilled in different ways. So those ones who are very good in expressive language. There are those ones who, in as much as they're not stammering, but they are not very good with verbal expression. And so that should also be considered, and employers should give enough support in terms of employment. And then I would call upon the government to register people who stammer and give them the disability card.
Well said, Dr. John Omo Nala, who is a developmental and learning disability consultant, and of course Duncan Dirangu, who speaks with a stammer. Thank you for being so candid about your journey and helping us understand how we can help along those who live with a stammer. Time now for a health tip.
I have here my baked fish fillet, brown rice, some vegetables, and these are spinach. This is a balanced plate for a diabetic person that you can choose to eat either for lunch or for dinner. Why brown rice? Full of fiber, full of manganese, magnesium, and there's absorption in the stomach takes a longer time. On the other hand, I have a plate as well. This is a more vegetarian if you don't feel like doing meat. I have my black beans stir-fried with some pumpkins. These are spinach and whole wheat pumpkin chapati. You can either do this for lunch or for dinner. Also as well, whole grains are full of fiber. It takes longer time for digestion, so releasing your blood sugars slowly into your system.
Information is definitely power, as we learned more about stammering and stuttering. Thank you for your comments and your questions coming through on our social media handles. Dr. Onala will be answering all of your queries. And remember, we've been coming to you from the 4 Points by Sheraton here in Hurlingham. My name is Gladys Gashanja. Until next time, see you. Today, we're coming to you from the 4 Points by Sheraton here at Hurlingham. Now, by the way, wacha kunidistract isitatulia. Yeah. Na venye ilikuwa mrefu hiyo. Man.